Okay. Well, today I'll be speaking about the introduction of acupuncture treatment recommendations in Korean medicine clinical practice guidelines. Well, Dr. Chin Chan made a very perfect introduction for me, so maybe I can just go over my introduction. I'm the professor at Kyung University Korean Medicine College, and I received my Korean medicine doctor, Master of Science, and PhD all at Kyung University. Well, this is a picture of our campus. Um, we have about 1,360 professors and about 34,000 students. Among them are 600 students are of Korean medicine. Maybe if you have the chance to visit Korea, I can arrange a tour for you in our beautiful campus. And also our university has two hospitals, um, both in the Seoul area. And the hospital I work at is the Gyeonggi Medical Center, which has the conventional Western medicine hospital, the Korean medicine hospital, and the dental medicine hospital. So it is one of the largest university hospitals that has all three departments. Well, I'll be introducing to you the related organizations related to the development of Korean medicine clinical practice guidelines. Well, the Korean government decided that we need to develop a evidence-based traditional medicine or a science-based traditional medicine, and to standardize the Korean medicine system so that it can be implemented into the national health insurance system. So they have been funding development projects for various medical conditions, the clinical guidelines for only Korean medicine. So based on these developments, it could be a foundation for further development and institutionalization into the mainstream of the international medical system. On top of the government, the Ministry of Health and Welfare comes in. So the Ministry of Health and Welfare has a independent or separate bureau that only specializes for traditional Korean medicine. So under the Office for Healthcare Policies, you could see that we have the Bureau of Traditional Korean Medicine that take care of divisions of traditional Korean medicine policy and the division of traditional Korean medicine industry. They will develop and implement new policies concerning the traditional Korean medicine. Also, they will be funding various R&Ds concerning the Korean traditional medicine. So among the institutes that are funded by the government, the most top two representative institutes will be the Korean Health Industry Development Institute. So the KIDI funds various research R&D projects concerning the health area, not only traditional medicine, but also conventional Western medicine, pharmacology, and nursing, and so on, public health, and so on. And the other will be the National Development Institute of Korean Medicine. Now, this institute is specialized for the Korean medicine. So the purpose of the establishment was the building the basis of promoting Korean medicine, promoting the health of Koreans through R&D and industrial promotion, and contributing to the economic growth of the country. So in the NICOM, they established a national clearinghouse for Korean medicine. They would provide us with various clinical practice guidelines concerning Korean medicine, and also data concerning clinical trials or maybe case reports, and also various educational resources concerning traditional Korean medicine. Now here, the Society of Korean Medicine comes in. So they plan to fund projects for developing clinical practice guidelines, but they need a specialist to do this. So they would offer the Society of Korean Medicine to be the principal investigator of the development process. Our society is the representative and the leading society of the academic society concerning traditional Korean medicine. We have 45 member societies. You can see here that the member societies have diverse specialties and diverse various research areas. So they are specialized for various diseases. So you can see here, there's the Internal Medicine Society, the Korean Acupuncture and Moxie Medicine Society, a society concerning ENT or gynecology, pediatrics, herbalology, and so on. So the 45 specialized member societies are very special asset for our society. So these member societies will be in charge of developing the clinical practice guidelines. So during the development of the clinical practice guideline, there may be gaps between the scientific findings and what is really going on in the clinics. So in order to modify the gap, the Association of Korean Medicine comes in. So they will review and revise and also monitor the development process of the various CPGs. This is the whole contributed institutes in the development of the CPGs in Korea. So based on the results of the CPG developments, we hope that the national health insurance system will adopt more Korean medicine treatment methods into the national health insurance system, so that it will be covered by the health insurance. So more patients will be able to visit Korean medicine clinics with more cheaper costs. So I will introduce to you the development process of CPGs. First, we educate the researchers on the methods of developing the clinical practice guidelines. And for each disease, they will organize the development committee, the review and revise board. And these development committees will undergo literature reviews, systematic reviews, and meta-analysis to find scientific evidence to establish recommendations for Korean medicine treatments. But after the systematic review or meta-analysis, if we find the lack of data or lack of evidence, we also did surveys among the Korean medicine doctors to find out not the standard treatment, but what the average treatment is taking, what really takes place in Korean medicine clinics. And after that, even after doing the literature review and the survey, if we feel the lack of data, we proceeded with clinical studies to supplement new data, scientific findings to strengthen the recommendations in the clinical practice guideline. And based on all these data, the consensus of experts were reached to establish recommendations and make the clinical guideline. During the systematic review, we would review all the scientific papers and evaluate the risk of bias based on the Cochrane risk of bias tools. And this is an example of what would the meta-analysis would show. So we would evaluate all the data and the strength of the effects of each treatment for each medical condition. And then based on these findings, we would grade the recommendation and assessment, development, evaluations, the level of evidence. So if the well-designed RCTs are abundant and the data suggests a strong effect of a certain treatment, the level of evidence will be very high. But if there is lack of studies and there's only maybe clinical trials of small sizes, the study evidence level might be insufficient or low. And based on the level of the evidence, the recommendation strength will be different. So if we can strongly recommend the treatment, it will be the grade A, and we will state that we recommend a certain treatment. But if there is lack of data, it might be grade GPP, where we could make recommendation only on basis of expert consensus. So when there is lack of data, we also go through clinical trials. For example, while I was developing the clinical practice guideline for low back pain, I found that there was only little numbers of studies concerning thread embedding therapy for chronic low back pain. So we had to do the clinical trial ourselves. So we designed clinical trials, and based on the findings, we would supplement the data and strengthen the recommendation levels. So this is another example of what the Korean Medicine Clinical Practice Guideline will be providing. They will be providing recommendations for various treatment methods. The Korean medicine doctors not only use acupuncture, but we use different interventions. So based on the interventions that are really used in Korean medicine hospitals, we make recommendations, and the recommendation grades or the level of evidence will be provided. And clinical considerations of maybe what kind of acupuncture point, specific points we should use, or what the design of treatment should be like is provided in the clinical consideration area. So I will introduce to you some of the developed standard clinical practice guidelines. Until now, we have developed 38 clinical practice guidelines for 38 different medical conditions, and 19 are under development. And there are 72 pre-existing CPGs, but these CPGs were developed in the long past, so it needs to be updated. So we think that the most well-managed or high-quality CPGs are the 38 that were developed recently. Those 38 recently developed CPGs are considering these medical conditions. You can see that it covers a broad area, maybe the growth disorders, osteoporosis, IBS, post-traumatic stress disorders, and also post-surgery recovery, and also migraine, spinal stenosis, dementia, dysmenorrhea, allergic rhinitis, anxiety disorder, and so on. So there is a English version of the CPGs, and they will be provided through online databases. So in the near future, I think you'll be able to download the CPG English versions and take into reference when you use acupuncture in clinical hours. So this is an example of one CPG. It is about the childhood and adolescent growth disorder. You know that the Asian parents are very competitive, so they not only want their children to be very smart, but they want their children to be very well built and their height to be very higher than their friends. So they are very concerned about the growth. So the Society of Korean Medicine Pediatrics made these recommendations, and among the recommendations concerning acupuncture was the 5th recommendation, and they recommended that in pediatric patients with idiopathic short stature, to improve growth in clinical care, acupuncture may be considered rather than behavioral management. So they found a randomized controlled trial that was comparing acupuncture with behavioral management, and they concluded that acupuncture showed better effects compared to the behavioral management, but there was only some studies. So you can see that the evidence level is still low, and the recommendation strength is only C. But I think this is the starting point. We have found what kind of study we have to do more, and we could build on this establishment. And they also provide us with clinical considerations to use acupuncture points for growth clinics, ST36, ST35, gallbladder 34, gallbladder 39, spleen 6, kidney 3, bladder 60, kidney 1, liver 4, large intestine 4, liver 3, and GV20, and so on. And also they suggested auricular acupuncture points such as the endocrine, subcortex, adrenal gland, thyroid, heart, spleen, and so on. So they also provide us data with some considerations we would take into reference in clinics. And all the CPGs developed recently provide these kinds of flow charts. So in the upper area, it will be the flow chart for diagnosing the patient and evaluating the patient, so that if the patient needs referral to Western medicine, the Korean medicine doctor can take into reference and rule out the different medical conditions that need to be treated by Western medicine. For example, if they have skeleton malformation, or they have Turner syndrome and other syndromes that needs more through diagnostic evaluations, they will be referred to the Western medicine. If not, they will take evaluation for secondary sexual characteristics and GnRH stimulation test. And based on the test results, the patients can be classified into 3 groups. So based on the classification, the recommendations for each intervention is provided below. So maybe recommendations for herbal medicine, recommendations for acupuncture, recommendations concerning manual therapy, and combination therapy, which means the combination of different Korean medicine interventions, and also collaborative therapy, where it means the collaboration between Western and Korean medicine. Also, this is another example of the clinical practice guideline for osteoporosis. So you could see here that because there were more studies done and more data, the level of evidence is stronger compared to the pediatric conditions. Also, you could see that the recommendation grades are more stronger than compared to the growth clinics. So here, they recommend that acupuncture should be considered to improve bone density and pain-related indicators of osteoporosis. But here, you can see that they do not provide us with specific acupuncture points. This is because when we provide standardized acupuncture points, we select the points that were most frequently used in acupuncture studies, or maybe the acupuncture points that show the strongest effects in RCTs. But if the diversity of acupuncture point selection was very wide in various studies, they would not provide the standardized acupuncture points. So we could develop a standardized acupuncture prescription maybe in the future. The osteoporosis team also provided us with the flowchart for the clinical algorithm. The upper part will be the diagnosis and evaluation and classification of the patients. And then we could pick from the interventions that we could provide to the patients. So independent treatments, which will be the Korean medicine interventions applied alone, and the combination treatment of Korean medicine interventions, and also integrative treatment methods that were that had scientific evidences are provided through these graphs. Another example would be the IBS, irritable bowel syndrome. They also found that there were moderate evidence levels for making recommendations for acupuncture for IBS conditions. They also suggested acupuncture points such as ST25, GV20, and so on. So you can check the acupuncture points and the treatment sessions in the clinical considerations. So because the limited time, I cannot introduce to you all 38 clinical practice guidelines.
You have 2 minutes left.
Yes, okay, thank you. And you can see that you can get an idea that the clinical practice guidelines are providing the flowcharts for the Korean medicine doctors to take into reference. So for the detailed contents, maybe I will have another chance in the future to introduce to you more thoroughly about how the clinical practice guidelines are making recommendations about traditional medicine for various medical conditions. So I'll have to skip the other. You'll see there are also clinical practice guidelines for migraine or post-operative treatments, and also cancer and degenerative lumbar spinal stenosis, and so on. So these data are all online. So in the near future, if they provide us with English version, I will not hesitate to let you know about the links. Well, thank you. And if you have questions, I'll be more than welcome to answer them.
Thank you, Dr. Dong Woonam, for that fascinating trip through your NICON program or guidelines. It seems to cover a lot of areas of research